Good morning, guys. I want to talk about something really important today, and that's why you need to be seeing a body contouring expert for all your plastic surgery needs. Obviously, I'm talking about breast and body here, not the face, okay? Look, it's not just the patients who lose 100 pounds that need to see body contouring experts. It's the patients who are getting straight breast augmentation. There is a deeper level of understanding for body contouring surgeons on the way the skin moves, when skin removal is needed, and things like that, that somebody who doesn't do body contouring cannot understand. Obviously, you have to be experienced in breast implant surgery too. That is a given, okay? On Monday, I saw 4 patients for revision surgery. All of them needed more extensive procedures than they were ever told, and the expectations were not provided. I talked to a patient yesterday who lost over 200 pounds and was getting ready to have surgery with a surgeon who literally has 3 tummy tuck pictures on his website, all with poor results. That surgeon is inexperienced, and that patient is going to be high risk for not only a bad result, but complications, which is going to cost her a lot more in the long run. Okay? So remember, if you coming for a breast augmentation and you think I just need a breast augmentation, you have to realize that a lot of surgeons out there may not have comfort with doing breast lift with implants, and you may get recommendations that you don't need a breast lift when in fact you do. If any of your breast hangs down below the breast fold, you need a breast lift. All right. Similarly, if you lean forward and any of your skin hangs off your abdomen, you need a fleur-de-lis tummy tuck. All right. Those are probably the 2 most common uh, inadequate skin removal with procedures that I see coming. Obviously, there's a lot of patients that need lower body lifts, and I'm not going to go into that as much. But you need to make sure that you're getting the right procedure to match your expectations. If you need a breast lift and you don't get it, the implant is going to fall, and it's going to fall below the breast fold, and you're going to lose the fullness in the top half of your breast. And you're going to go back and you're going to tell your surgeon what happened, and your surgeon's going to say, we need a bigger implant. That is not the right answer. The truth is, they teach surgeons how to do cosmetic surgery in residency, but there's very little training, and it's not always experts that are training them. So most surgeons really have to figure this out on their own. You probably want to see somebody who's been out of practice at least 5 years, maybe to 10 years, to know that that person's got experience. They have to have a lot of pictures. Surgeons are afraid to do breast lift with implants if they're not experienced because the complication risk is high. Or they'll tell you to separate the procedure. Similarly, they'll tell you you don't need a fleur-de-lis. We can get away with it, or you'll do okay. And then they'll show you pictures of patients laying down, standing up, leaning back. They'll never show you that patient leaning forward. You have to remember that your skin is attached to your abdomen for the first 6 weeks after surgery, and then it starts to detach. And so you're not even going to see the problems till a few months until the swelling starts. So by a year, you're going to be left with a situation where you have to essentially redo the entire surgery. All right. Make sure that your surgeon has lots of pictures on their website. A body contouring expert has hundreds of pictures on their websites, does at least 100 of each procedure a year. A body contouring expert takes care of massive weight loss patients, non-massive weight loss patients, does lots of breast surgery. I happen to also have done a lot of breast reconstruction, which is also helpful in knowing how to take apart the breast. Your surgeon should be an expert in liposuction as well. If they're not doing lipo with their procedures, they are not a body contouring expert. If they don't know how to do Brazilian butt lifts, they're not a body contouring expert. If they've never done an arm lift, a reverse tummy tuck, a bra line lift, a thigh lift, they are not a body contouring expert. People, these are who you need to be seeing. There are very few of them. There may not be one in your state. You will need to travel, especially when the condition dictates. At the bare minimum, I recommend that you get a consultation with one so you can know at least what's needed and then realize what your expectations will be if it's not done. All right. So keep those tips in mind for your best outcome. Thank you.